Hello and welcome to the fourth Mental Health COVID-19 webinar. My name is Niall Boyce. I am the editor of The Lancet Psychiatry, and these webinars are a collaboration between ourselves, between MHPSS, the Mental Health Innovation Network, and also United Global Mental Health. And we've also been very grateful for the enthusiasm and advice of WHO in putting these panels together. So the first thing to say is that this session is being recorded, and the recording will be made available with a summary after the webinar. If you're going to tweet, we absolutely encourage you. Please use the hashtag COVID-19MH. So please do tweet us your thoughts and summaries of what we're saying for a wider audience on social media. Without any further ado, I'm just going to introduce our panel. We've got a great panel today. The discussion is on the subject of funding, funding for clinical practice, funding for research in response to the COVID-19 pandemic. And we've got Sarah Kline from United Global Mental Health, Danielle Kemmer from the International Alliance of Mental Health Funders. We've also got Rajvi Mariwala from the Mariwala Foundation, and Nasri Omar, who's the Focal Point Mental Health System and Services Division, Mental Health Division in the Ministry of Health of the Government of Kenya. So one of the great opportunities we have in these webinars is to maybe have discussions which we should have been having before the pandemic in terms of mental health, in terms of how it's prioritized and it's funded. So we very much encourage you to join the discussion, email us your questions, put your questions in the chat. We'll get around to as many as we can. But I'm going to start off by just talking to each of the panel in turn. And I'd like to start with Sarah, if I may. So Sarah, from your point of view with United GMH, what are the trends so far in funding for mental health as part of the COVID response? And what do you think the priority target donors are for mobilizing resources?
So United for Global Mental Health helps track financing for mental health and encourage political and financial support for mental health. And way before the pandemic, we've always seen that nationally mental health is chronically underfunded, and the same globally. So many people will be aware of the fact that it's on average around 2% or less of health budgets. So during the outbreak response, what we're seeing is some countries, national governments, are announcing new funds for mental health. Those include countries such as New Zealand and Australia and the UK, but many countries, in fact most countries, are not yet prioritising additional support. And in order to make that happen, as we'll hear from other panellists, we really need public demand as well as the medical sector and others to demand support. But we're not seeing significant funding across the national, not across all national governments. In terms of globally on mental health, there's also been a lot of announcements of new money, particularly from multilateral organisations and now increasingly from bilateral governments. As you know, a lot of that is for physical health and for physical health infrastructure to support health workers. Very, very little of that is actually for mental health, in fact, very, very little. But we do need that. We do need mental health included in the plans of the WHO and the UN, with significant resources attached to it. And again, we need the demand for that from recipients, so from national governments and from UN agencies themselves and from NGOs.
So if I could follow up on that, Sarah, you were talking about mental health versus physical health there. And to my mind, one of the big problems in mental health funding globally, nationally, over the past few decades has been this siloing of physical health and mental health programs, whereas in fact there are points of synergy and overlap which can be identified. Is this sort of siloing again a problem here? And if so, how might we overcome it?
Yes, I do think it is a problem. I think that there's I used to work for WHO for a number of years on resource mobilization and covering outbreaks and humanitarian responses. It is normal, unfortunately, that there is a bit of a silo effect. I think there are examples of where it makes sense to join up physical and mental health, and we've talked about that in some of the webinars already. So, for example, the most vulnerable groups around mental health can also be a threat, if you like, in terms of the spread of the disease. So what happens in psychiatric institutions, what happens to support people with addictions or people who are homeless. Those are all concerns that should be both physical and mental health. There's also insights and support that mental health experts can give around public health information and the adherence of the public to health information, which is absolutely critical to this response. And I guess the third and equally important point is that we need mental health support for frontline workers, as we've talked about again in this webinar series already. And if we don't give them that support, then we will not have a sustained workforce who are able to cope through what is going to be quite a long period.
Thank you. Now I'd like to go from the general to the specific. So I'd like to turn to Nasri. Now, Nasri, can you tell us a bit about the funding needs and specifically the mental health funding needs of Kenya and of a country like Kenya? How is the Kenyan government responding to mental health at this time, and how does the funding work exactly? I think you're muted, Nasri.
Yeah, sorry about that.
Great.
So,
okay.
For Kenya, what has been happening is we got recurrent expenditure on the staff. We also were given, for the first time, the plans are underway by the government to hire psychologists, which is a very new cadre in public service, which were not recognized before. And the plan is that they're going to hire psychologists for all the 47 counties in the country to support MHPSS activities. And also the government has been helpful, and it has helped us in developing and disseminating guidelines, SOPs and training manuals, specifically for MHPSS COVID-19 response. And also we're able to do virtual trainings, which were underway across the country on COVID-19 and PFA, psychological first aid. And this was actually successful, and it has reduced the costs and the risk associated with face-to-face trainings for us. And we've been able to provide free psychiatric reviews for persons in quarantine or isolation. Those ones are the government facilities. And we've also been able to provide essential medication for psychiatric emergencies, which is also free of charge from the National Psychiatric Referral Hospital. And the mental health and psychosocial support team has actually been put as one of the frontline workers who need PPEs when they're required to do on-site counseling. So that's a big step for us, because initially we were not considered as one of the key categories who would require PPEs. And the other thing was that we are doing telecounseling, which is a relatively new thing in Kenya. And we're able to do pre and post-test counseling, and we're doing most of them remotely. And we don't have to go and do face-to-face. And the reception has also been good with this. We're also using technology in terms of Zoom and all that to do group counseling. And the government has supported us also in, there's a resource mobilization team of the National Task Force, which MHPSS is part of. And we are really pushing to get release of funds from that team. And there's also a national COVID-19 fund, which we are also sending our budget and trying to get money specifically for MHPSS. And we're also collaborating with other government agencies to increase our capacity in terms of, because the HR is very limited. So right now we're using police counselors. We've got police counselors to come in and help us. And also the MHPSS component has been included in the setting up of quarantine and isolation centers, social welfare needs of people who have severe disabilities, including mental health. Severe mental health disorders is also being looked into in terms of cash transfer system. And that's government, but we also have private sector is coming in to help us as well. And also the Kenya Red Cross is a big partner we have right now for psychosocial support. Maybe I don't know if that answers the question.
It does, and I'm curious because what you're describing is a crisis response, and yet there are elements of it, such as using telecounseling and Zoom, and these are things which I can imagine still being used, indeed developing further once this crisis situation is out of the way. So you're kind of doing two things here. You're both responding to a crisis, but there's also maybe going to be a permanent change, and maybe a change for the better in mental health provision in Kenya as a result of this crisis response.
Yes, when we started doing the telecounseling, and we started first in the quarantine sites and the isolation centers, and then we realized the demand is really high. And now we are making plans. We've actually written a proposal for a telecounseling call center at the National Psychiatric Referral Hospital. And once that is done, that will be, it's part of our long-term investment, because that line eventually we're going to convert it to the National Suicide Hotline. So this will be able to provide MHPSS support now within the crisis and even after the crisis.
Thank you. I'd like to turn now to the world of research. This was the subject of our discussion last week, where we talked about research priorities. This week, maybe we'll focus a little bit on how we pay for them, with Danielle joining us. Now, I know that the International Alliance of Mental Health Research Funders did a brief survey of its members concerning funding in this crisis. I wonder if you could tell us first a little bit more about your organization, who it consists of, who it represents, and what the results were of this survey.
Thank you, Niall. So the International Alliance of Mental Health Research Funders, we are a funders forum, and we unite basically different types of funders. On the one hand, they're the large government research funders. And then on the other hand, we have philanthropic foundations and fundraising charities as part of our membership. And we conducted a survey just to really get a sense of what those funders actually do as a response. I mean, it is a very specific group that really targets a specific response, if you want. And so I have to say, depending on the type of organization, the responses are quite different. And so one thing I should say, though, what was the same for everybody, is that there's a mixture of immediate priorities that everyone tries to address. And this is more in terms of crisis management, like what are the needs right now. But they're also early thinking of long-term strategies, and that relates a little bit to what you just mentioned, Niall, that some of the things that are deployed right now very quickly might actually stick around after this all dies down. And so, so there is this response on different levels. But I have to say, so they are the government funders, and they are often now part of the government response to the crisis. So I should say, though, I'm mostly speaking about high-income research funders. That might be a different context. And so they got tasked by the governments to be part of their management plan. So basically any activity that's not COVID related was put on hold for many of them and most of them. And so the immediate dealings were really how do we manage our already funded communities? So there were things like extending deadlines, like developing bridge funding for some of their communities, just making sure that these people are kept afloat. And I also have to say, one of the things I observed, there is some recycling of current calls that were already in the planning before the crisis, and now they try to tailor this quickly to the immediate needs. So these are the large government funders. There is a big push for the development and adoption of standards and harmonization in the mental health research sector. And I think more so than ever. And this is simply, I mean, there is now so much activity going on to really get some of these research questions answered. I mean, there's very little we actually do know also what the mental health research, what the mental health impacts are of these really unprecedented measures. I mean, the high levels of isolation of people. So what are actually the needs and gaps, and what are the research questions that need to be addressed? And so there is a lot of thinking about that. So ongoing programs being recycled to get some of those questions answered quickly. Then on the other hand, the philanthropic sector, so they reacted very fast. And one thing I saw is that there was tremendous outreach to their funded communities. So really trying to understand what are the needs, what are the specific needs that we could address. They were extremely fast to respond, some of those philanthropic funders and charities. They even increased their funding very quickly, extended funding. So these are the main, I think the main things we're seeing. There's an ongoing discussion about long-term strategies. I think that's extremely important in the mental health research sector in particular. There's so many unknowns right now. And I think it's in the interest of us all to really go after the things that do work, where we create the evidence to identify the most effective solutions that, well, address the needs right now, but also in the longer term, the long-term effects of this crisis.
Now, before this crisis happened, what I was seeing was an increased interest by funders in specifically the subject of youth mental health.
Mm-hmm.
Is this still a priority within this pandemic? Has this changed? Or maybe it's even more important than it was, considering the impact which this is likely to have on youth?
So I do think the youth mental health has always been like front and center, simply also through the fact that a lot of the mental health issues start very early in life. I think there has been the thinking has gone a bit broader in the sense that suddenly we're all people with lived experience, basically. I mean, we're all affected in one way or the other. So there are needs now that pop up that we didn't really think they would be so strong in other populations. However, I think the impact on young people, again, I mean, these are groups that where the peer contacts, peer networks are extremely important. There is an interruption right now. It's going to be interesting to see what the long-term effects are, because these demographic groups, like the young people, they're also pretty good with working in virtual networks, like using all those tools that we now try to deploy for other age groups and demographics that might be less used to using those. School disruptions is certainly a major thing. So how do we prevent young people from basically dropping school, failing in school? So the mission that remain, and I have to say the networks that are quite well established for youth mental health now, they certainly keep up the work. So they keep on being a very important group of attention for sure.
Thank you very much. Now, Raj, I'd like to turn to you because you really have a unique perspective on the situation in India. You're both a funder and an advocacy organization. So what are you seeing as the greatest needs on the ground right now, and how is the Indian philanthropic community and indeed the government responding to those needs?
So in India, I think COVID-19 has thrown up some very important fault lines, and it shows very clearly that it's not a pandemic with just a public health dimension, but it is inextricably linked to human rights, livelihoods, access to care, and social justice. So just to start off this discussion, I'm going to say that we had to go into lockdown. It was somewhat unplanned. There were migrant and daily workers in many urban locations that got stuck overnight without maybe shelter, without daily wages. And so in this country, we've already seen, at my last count, 43 reported deaths due to migration-related accidents. 15 of these deaths were caused by just road accidents of people trying to walk or cycle back to their home states. And then linked to that, at least 35 deaths by suicide due to mental health issues such as fear around COVID, COVID stigma, alcohol and other substance withdrawal. So we are seeing mental health issues crop up front and center. Now, in terms of the government responses, the government has worked to put in place lockdown and quarantine in all the states, but because public health is a state subject, the responses of each state in India are varied. The levels of infection across states are varied. But the government's focus right now is on testing and quarantine and providing more physical health resources. There are very few states that have added a mental health response, and I'm going to say that it's noteworthy that the states that have added the mental health response, they've done so because there's a vibrant mental health community that stepped up to the plate rather quickly. So we have seen the mental health community itself step up and offer an increased number of helplines, an increased amount of work with the state, offering resources. And I would say similarly with the philanthropic industry, the response was quick, and a lot of leaders of philanthropy in India asked for two things. In the immediate term, they asked for a large donor response for effective support to COVID. They asked to strengthen non-profit partners that philanthropy and CSR is working with. And they asked for a long-term loosening of restrictions on grants, converting current maybe project grants to a longer-term framework. So that's been the response on both of these ends. There is a central government task force on COVID, and unfortunately, it does not include a mental health expert. However, there are different state government task forces on COVID that do, but that varies from state to state. Notably, and I'm very happy to announce that the Indian Council for Medical Research is planning a study which is going to include mental health. So that is a great thing to have been done. But overall, I think the response on mental health has been mixed.
There are so many actors involved as well in this, and this must be a challenge of coordination.
Absolutely. I mean, state governments and central governments have their own task force and their own coordination. Central governments, however, and state governments have been reaching out to civil society as they recognize the magnitude of need, as civil society has been working on PPE, ventilators, and of course, mental health support. Though I'm going to say that frontline workers are not receiving mental health support. And of course, I would say that mental health workers themselves are invisible frontline support, which isn't being considered at all. So I think there is a massive amount of coordination going on, and yet mental health, though it's an important part of the picture in many places, is somewhat invisible.
Thank you very much. So I'm just seeing some questions are coming through over the email, so I'll put those to the panel in a moment. But first of all, just a general question for whoever feels like answering it. For people who are watching this webinar and they're maybe thinking of applying for funding on a COVID-19 related mental health project, what advice would you give them? Does anyone want to start with that?
I'm happy to give a start.
Yes.
As an organisation, we've pulled together a website which is open access, where you can look at financing for mental health in different contexts and from different kinds of donor, and that includes one on COVID. I think what's fair to say is that for national governments looking for international funding from multilaterals, bilaterals, as I said, they need to make the case and they need to demand it. And we would like to see greater emphasis by the UN and UN agencies, including WHO, to including mental health in its response strategies. And people should look at the next round of those response strategies, which should be available in the next week or two. As NGOs, it's much harder because much of the funding that's been discussed so far, at least internationally, doesn't trickle down to NGOs. So in that respect, I think trusts and foundations are a much better bet. So I think those are some of the initial guidance, but we will see a lot more opportunity perhaps over the coming weeks and months.
Thank you. Does anyone else have a response to that? Yes, Danielle.
Well, so I think speaking again to the research funding here, I think it's really important to keep an eye on the evidence to really identify what works in this situation for everybody. And also keeping in mind the new normal and the evolving context that we're all faced with. So I think for those researchers that really try to just push their programs through that they had developed before the crisis and just try to kind of tweak them to get them funded now, it's probably going to be quite difficult. But as a matter of fact, I mean, the rate of innovation right now is very high. there is things can go through that there's a willingness to adopt quickly things that work. That happens quite rarely, and so I think that's the silver lining of the situation. I would also say one important thing is to really keep up the quality. There is the volume has increased tremendously, and that necessarily it doesn't mean that the quality has equally increased. So really keeping an eye on due diligence and doing your homework when you apply. Like we can only fund what is really good, and that's basically true for now as it's ever been true. And there will be longer term adjustments, and I think for those that think forward and try to understand like some of the elements that are rolled out right now, that are implemented, that seem effective. I mean, where we start collecting data and see there's a real impact, to really work with those, with this new context, and build on this new reality, not assuming that necessarily everything will go back to the way it was before. I think that would be my advice.
Thank you. Raj and Nasri, do you have anything to add to that?
Yeah, I think the challenge for us is that mental health is not a standalone funding stream. And maybe going forward, people should find a way to make mental health to be a funding stream on its own and not under bigger subcommittees where you can be swallowed up and forgotten there. So it's important to have mental health to be a funding stream on its own, and even the funders as well, because when they are contributing to the national fund, they don't specifically say that this money will go. They have so many other things they want the money to go to, maybe PPEs and other things, which are equally as important. And maybe for funders can help us and say that this money is specifically for mental health, or there must be a pillar of mental health in the funding for this. That would really enable us to have some funds released our way. And also, I think it's a delicate balance. You don't want to lose on funding on the immediate response, and you also want to prepare for the response for MHPSS services, even after COVID, where the demand might also increase due to the expected long-term impact of the crisis. So I think we need to plan, we need to advocate a lot for funding and why we need it now, and why we'll need for mental health, we'll need even more funding even after the crisis. And yeah, we need to also strengthen our systems to be able to cope even after the crisis. Yeah.
Thank you. So taking a long-term view as well as the short-term crisis response seems to be something that we're coming back to. Raj, do you have anything to add on this topic?
Absolutely. So I would say that as mental health research funders, and this is something that we've done, it's somewhat our responsibility to help get more funders, more philanthropists, more CSR interested in funding mental health. And so if I have to look at COVID, I'd want to talk about success stories. So for example, in India, there's a state called Kerala. Now, Kerala was one of the first states to be badly hit by COVID. But within 1.5 months, they have COVID under control. They have very few new cases every day. And that's for some reasons. Kerala faced an outbreak of a virus called Nipah, also from bats, about 1.5 years ago. They also faced floods. At this time, they learned to integrate mental health into disaster response. So Kerala not only provided information in an accessible manner, not only provided services such as food, ration, and shelter, but each district already had a set up mental health helpline, and people knew these numbers. So Kerala as a state has dedicated mental health helplines for all of its 14 districts. And what it's done is helped assuage people's fears about COVID. It's helped to build trust. And of course, it's helped the state to gain control of COVID. So I'm going to say what I tell most other funders when we're looking at them and asking them to step up for mental health is some amount of mental health funding is going to make whatever your other intervention is far more rigorous and far more effective, because mental health is a development issue. And that's what I want to say.
Thank you. That's striking a very optimistic tone, which is of course very welcome. And I'm pleased to say that we have a question from our audience, which is for Nasri, and this is similarly, quite optimistic, saying that it's great to see this innovation in response to a crisis, Nasri. How could this be shared with other ministries of health in Africa and elsewhere?
Well, that's a great question. Yeah, so the telecounseling services, we started, I think we need researchers, because we are not researchers, we are policymakers. For it to be shared, for us to do a case study, we need to get the researchers on board. Because when we started the telecounseling, we just started with people's personal handsets. We'd just put airtime for our counselors, and they would call the persons who are either COVID positive or in distress, and we'd reach out to them in the quarantine and isolation centers. But now moving forward, as I said, we want to set up a call center specifically for telecounseling, and also even offer telepsychiatry services, because we have very little human resource in terms of mental health in Kenya. So I think we need to work, this I think is a task for policymakers in Kenya like us. We need to sit down and work with researchers so that we can develop probably a case study or a paper on this and probably share it with the rest, maybe a best practice, because this is just something we're starting now and we haven't done it before. So there are so many lessons we need to learn, maybe mistakes we need to make that other countries should not repeat, and probably find a better way, considering the mobile phone coverage in Africa is actually high. So telecounseling can be a modality which can be used in our setting.
Yeah, I mean, I completely agree. I think that it's important to share those innovations. And I think this leads into something which has been worrying me a bit, which is that the response to the pandemic internationally, and I'm simply talking about the medical response here, the public health response, has really suffered from perhaps a more fragmented and fractured international community than we've had for some decades. And I think that's been a real problem. How can we coordinate a mental health response to this that is international in the face of this sort of fragmentation? Sarah, perhaps you have some thoughts on that.
A little bit. I mean, I think maybe it's because I used to work for WHO, but WHO is the UN agency with the global lead for mental health. So I think internationally, people look to WHO to help coordinate that at a global level, and in their regional advisors to, for example, the regional advisor in Afro for mental health should be looking at what are the best practices across that region and sharing them within the region and then more broadly. And we saw that when I worked on the Ebola outbreak response, where methodology from, in fact, post the Rwandan genocide and the healing of community dialogues through community healing dialogues, that was successfully transferred to the Ebola setting, post-Ebola. And there are those kinds of learnings that WHO, UNICEF, other UN agencies should be in a position to help the international community do in real time. So there's the research, but there's also just the real-time sharing of information. But that won't happen if they don't take that leadership role and if they don't have the money and resources to do it, which again is why we're concerned that UN and global plan should include that coordination role. And then in terms of an outbreak in an emergency setting, particularly a crisis humanitarian place where you have a cluster system, so you would normally have WHO leading the subcluster on mental health, usually in partnership with the Ministry of Health. And again, that's meant to help create a glue, if you like, within the country to make sure there's a joined up approach. So we do need that combination of global and national actors to work together and then to use those networks. And then in a more practical sense, I know that the Mental Health Innovation Network, one of the coordinators of these webinars, has been sharing best practice, and that's been something that WHO has been encouraging. So there is the informal as well as the more formal. But it is incredibly important because otherwise you have the danger of wasted resources and duplication, which again we've seen, and I saw in the early days of the Rohingya response, and again I was working with WHO. So.
Thank you. I have another question, and this is from Nick, who is the co-director of Euro Youth Mental Health. And Nick says, this one's for Danielle, I agree that youth mental health has been front and center, but it feels like this is only happening in high-income countries. How do you think funders can better help support low-income countries and support and engage young people currently and after the current situation?
So that's a very good question, and I would argue this is not only valid for the current COVID times. This was true before as much as it is now, and it's actually something that we've given a lot of thought, given especially that most young people do live in low resource settings. I mean, they do not live in high income countries. And I think I can speak from our forum, which has historically been really dominated by organizations that are based in high income countries. So we have now for the last few years really made efforts to change that. So we now include more and more organizations that are based in low and middle income countries. And I think to our conversations, especially when we think about a global youth mental health research agenda, it is absolutely crucial that representatives from those countries are around the table to discuss this. And we have made progress. We are by no means done with this, and this is ongoing work. Some of our members, actually, the youth engagement in low and middle income countries is a specific focus, and they now take on a leading role within our forum, also working with other major initiatives, so that this is not a siloed effort in itself, like engaging youth in low and middle income countries, but basically having those efforts incorporated in other major initiatives that are being launched. And there is, at least from what I've been observing, there is more collaboration, working together across initiatives as well. There's an increasing willingness to reach out, and we are really actively on the lookout for organizations that are based in low and middle income countries to join our group and to really help us think about what are the most effective ways of engaging youth in low and middle income countries.
Thank you. So I've got another question here, and this is on a very specific issue. This is on the issue of suicide prevention. And the question is, what is or can be done for specific suicide prevention funding to be available, as this can get lost within other mental and health funds? Although, of course, the person asking this question says, you know, suicidal behavior isn't just a mental health and a health issue. It's sort of slightly broader than that. So I wonder what your thoughts are on that, Raj.
So what we have done here in India is to look at it in a couple of ways. Suicide is a big problem for us. Our youth, actually, the number one cause for young men is death by suicide. And so there are a couple of ways. One is to increase funding by sharing this data. There's a problem with this, however, because up until 2017, suicide or attempted suicide was criminalized in India. So there is a huge lack of data around it. That's number one. Number two, we have no national policy in place around suicide. So unfortunately, the issue is not seeing light from a policy end and also not from a data end. We don't have enough information. Now, even though it's been decriminalized, the stigma still exists. So at a very first level, before we do anything around suicide prevention, we need some information, enough programs to collect data with which we can advocate for further funds. So I suspect it's like this in maybe quite a few countries around us as well. The stigma of attempted suicide or suicide is extremely high, and we don't have the data. So I do believe that it's a very important topic. It's when talking about it in a group of larger funders, it does get the attention, but right now we just don't have enough data to be able to share and advocate strongly enough. So I think before even we advocate on suicide prevention, we have to advocate around resources, around research around suicide.
Yes, and this is, again, a broader issue, which is how we're going to design innovations if we're not collecting good data. And suicide has traditionally been really one of the most challenging areas for collecting good quality data, I think, in mental health globally. So I'd like to ask a sort of a brief roundup question for each of the panelists in turn. And as people who've watched a few of these webinars will know, I like these to be quite brief answers. So I'd like you to imagine that you're in a lift of a relatively low-rise building, and into that lift walks someone from government, a policymaker who has a responsibility for funding. And you've got to convince that person in the time that the lift goes up to a relatively small number of floors. How do you convince them of the need to prioritize funding of mental health practice and mental health research? What do you say in one line to release that money? Who'd like to start?
I can try.
Sarah, fantastic, go ahead.
Okay, well, I'm actually borrowing from a number of my panelists, but funding for mental health at this time makes the response more efficient and effective. The public will adhere to public health information, and health workers will feel supported enough to sustain their work.
Thank you. Danielle, from the research side, how would you convince someone that mental health research is the thing to fund right now?
So I would really point to these many polls and surveys that have been going on since the beginning of the crisis, and really the increasing threat to our workforce on productivity, and the big question marks we have right now, that we just don't know what the most effective interventions are to really weather that threat. So there is great need. I think that's would be the line I would use.
Thank you. So Nasri, so we have a lot of financial demands on government right now. We have demands in terms of the overall economic crisis, but then we've got demands on protective equipment, we've got demands on inpatient services, we've got demands on what will hopefully eventually be a vaccination program. In all of this, how do you find the space for mental health? How do you make a case for it?
Should I answer with a one line? Because I'm finding it difficult to come up with a line.
Let's go for 2 lines. We can be general.
So what has really helped us as Kenya was this increased demand for our services. Before we were in the task force, but we were an underdog, let me say that. So when people started asking in the quarantine sites and isolation centers, and the general public started asking for psychosocial support, that's when people started looking for us. So I think the demand in the service is very high for the whole population. The impact it has, COVID-19, is not only on the physical, but also on the mental health of the population due to loss of livelihood. We are having issues of GBV, child abuse, all of these things, and the impact of quarantine as well, and the curfew, which the country is currently in curfew. And this all exacerbate the physical, the psychological distress and mental illness in the population. So this is the time to invest so that we prevent. We have to also, as I think the paper on return of investments by United for Global Mental Health, I think if we invest now, we're able to get more benefits even economically for the country. So maybe that's my jumbled way of telling the government to give me more money.
Thank you. Raj.
Okay, so COVID-19 pandemic has thrown up the fault lines in our systems, structures, and policy. And as the whole world grapples with stigma, fear, anxiety, and uncertainty, let's join the dots that mental health is a development issue and cannot be considered in isolation from other areas of development, such as public health, employment, disaster response, and human rights.
Thank you very much. That was brilliant. So I'd like to thank you, Raj, Nasri, Sarah, Danielle, and United for Global Mental Health again for the technical support in getting this webinar online. Thank you to all of our viewers for joining us. The recording and the notes will be posted on the unitedgmh.org website very shortly. Now, for anyone who wants to learn more about funding for mental health, as Sarah mentioned, United GMH has just launched a new section on its website where you can find a wealth of reports and donor profiles to help the mental health community find funding. And this includes a briefing on funding for mental health during specifically the COVID-19 response. So that's in the news section of the United GMH website. Our next session is going to be on May the 5th at the same time. And this is going to be on mental health in COVID-19, what lessons can we learn on successful public health information at this time? So again, please go to the unitedgmh.org website to register, join, and submit your questions. I do hope that you'll join us. But for now, goodbye.